Dr. Greg Gamache here. I want to take a minute and discuss push-ups. Is that something you really should be adding to your exercise program? Is it good for you or not good for you? And when you look at exercise in general, it seems that exercise is good for every system of our body. Not only is it good for our systems of our body, but as far as stress goes, it seems to be one of the best stress management tools that we have. And so when you look at a push-up, is it good for you or is it not good for you? And the simple answer is yes and no. Like anybody that's deconditioned and getting back into the gym, you wouldn't expect to go into that gym that first day and load up a bar with every weight you could find and decide you're just going to bench press and haven't worked out forever. And the same really applies to something as simple as a push-up. If you're deconditioned and haven't worked out for a while, you just don't want to get on the ground and start doing push-ups for many reasons. One is the health of your body, whether it be your wrist or your shoulders or your elbows or your neck or your back. You could really cause damage if your body is really not used to that movement or has been so deconditioned that now that could potentially cause you pain. And so you just want to, if you know that's you, then the first thing you really should do is just modify your push-up. And you could do something as simple as doing what we call a wall push-up. You could put your feet a foot to 2 feet away from a wall, literally put your hands against the wall and lean in till you hit your chest on that wall and then push back out. And that might be far too easy for you, but that would be a simple modification just to see where you are in your fitness. From there, you could take that push-up and you could use a piece of furniture, a counter of some sort, and literally just lean into that counter, push yourself up, and just kind of modify it there. And that's going to be a little more difficult. You can kind of see how that feels on your body, whether your wrists or your elbows, or your shoulders. From there, you could go to the floor. On the floor, you could do what people have called girl push-ups, not to be sexist, but literally put your knees on the floor, let your body fall to the ground, then push up from there. And then you could go to a full push-up where you were actually putting your feet on the floor, and again, pushing from the chest to full lock out of your elbows. Now through any of that, there's nothing wrong with modification. I mean, people have injuries and people it hurt in different range of motion, especially as we age. And so you definitely want to modify your push-up. And what that simply means is maybe you're incapable of taking your chest all the way to the floor anymore. You definitely want to listen to your body. And if that causes you great shoulder pain or elbow pain or hurts your back or neck, then decrease your range of motion. Maybe just go 50% or 75% to the floor and then back up. But for whatever you're doing, we're looking at longevity when it comes to exercise. I mean, you don't get fit or you don't do something one time and then are done forever. We want to do things that allow us to function and feel better for the length of our life. And so anytime you do something new with your exercise program, you want to keep that in mind. So hope that's a little bit of information to help you along that fitness journey. Fitness will definitely bring years to life. But have an awesome day.